Good morning to all and welcome to this webinar. We're going to begin the session for today. Please use the interpretation button below your screen if you prefer to hear the session in Spanish, Portuguese, or English, and use the Q&A box below your screen to make questions for our speakers and panelists. Now I give the table to Dr. Leon Ederving, who will give the opening remarks and introduce the session.
Okay, Luis, thank you very much and good morning, everyone. I would like to welcome you to the Salt Awareness Week 2023 webinar, where we are urging everybody to ditch the salt for the sake of our hearts. PAHO is pleased to organize and conduct this activity to join the international community and our member states in promoting further policy actions to reduce salt consumption in our region and protect health in the population. Recently, the World Health Organization launched a global report on sodium intake reduction, which emphasizes that the largest number of death-related deaths, an estimated 1.89 million per year, is associated with excessive intake of sodium, a well-established cause of raised blood pressure and increased risk of cardiovascular disease. It is estimated that the average global sodium intake is 10.78 milligram of salt, more than double the WHO guidance of less than 5 grams of salt, equivalent a teaspoon. In our region, salt intake is about 9 grams of salt, and we are not in track in achieving the global targets of reducing sodium intake by 30%. But reducing sodium intake is one of the most cost-effective ways to improve the health and reduce the burden of non-communicable diseases. PAHO has been supporting its member states in reducing salt intake through the shake packets and implementing the best buys. According to the global report of sodium reduction intake, 8 countries established measures for sodium reduction formulation. Most are voluntary. Furthermore, 14 countries have established a supportive environment for sodium reduction, and 16 have conducted mass media campaigns. In addition, 9 countries have implemented mandatory front of pack labeling. There's an increase in the consumption of processed food, and a reduction in sodium content is very much needed. For this, PAHO has updated sodium reduction targets developed in cooperation with the WHO Collaborating Center for Nutrition Policies for Chronic Disease Prevention at the University of Toronto. And they were launched 1.5 years ago in October 21. In addition, PAHO has supported countries to monitor sodium content in processed and ultra-processed products, and the main results will be presented today by the Collaborating Center Director. In addition, we will hear from researchers of Argentina, Costa Rica, Peru, and Panama how they've used their data of sodium content in food to advance sodium reduction policies. Furthermore, PAHO has conducted health impact analysis of sodium reduction policies in a few countries of the Americas, and we expect to escalate this work to more countries. Finally, we will hear the basis of the needs for mandatory sodium reduction policies to effectively advance the implementation of the updated PAHO regional sodium reduction targets and how to protect the development of these policies from conflicts of interest. We thank you for your participation, and we hope this webinar continues to support countries to implement the cost-effective sodium reduction policies using the tools developed by PAHO WHO. So thank you very much, everyone, for your participation. And I think we now move on to the first presentation on the agenda. So I would like to introduce Dr. Mary Labbe. She is a professor and former chair of the Department of Nutritional Sciences of the University of Toronto, where she leads a research group on food and nutrition policy for population and health. She has received numerous national and international awards for her research in nutrition leadership and authored over 330 peer-reviewed scientific publications, food chapters, and government reports. She also chaired Canada's Trans Fat Task Force and the National Sodium Reduction Strategy for Canada, and has chaired or participated on numerous experts committees for the World Health Organization, PAHO, and the US National Academies of Science and Engineering and Medicine. She is the director of the WHO Collaborating Center on Nutrition Policy for Chronic Disease Prevention, with which she collaborates a lot. So please, Mary, you will have the floor for the first presentation today. Thank you very much.
Thank you very much, Leo. I'll just share my screen. And while I'm doing that, I'll just speak for a minute. Hopefully the screen share is okay.
Let's see.
Let's see. Are you able to see my screen? I'll put it on.
Not yet, but...
Not yet. It's showing, oh, it's doing circles. Oh,
okay, it should be there.
It's there now?
No, in a moment, I hope.
It looks like it's Zoom quit unexpectedly when I tried to share my presentation.
Mm-hmm. Let's try again.
Sorry, Leo, it didn't want to let me share my screen. Maybe if someone at PAHO could share my screen for me, and then I'll. Oh, thank you, Luis.
Okay, Luis is now sharing screen, so then maybe Luis can pass the slides while you talk.
Okay.
Yeah, so, just let me know when I pass to the next slide, Mary.
I'll just say next. Thank you, Luis. So thank you, thank you, everyone. I want to make a warm welcome to everyone. I looked on the participants, and I think the last time I checked, there were about 115 people, or maybe more, still continuing to join. So thank you all very much for attending this webinar. As Leo said, I'm the professor at the University of Toronto and director of a WHO Collaborating Center on Nutrition Policy for Chronic Disease Prevention. But why I'm here today is I also had the great honor of chairing the PAHO Technical Advisory Group on reducing sodium salt reduction in the Americas. And as part of that work, my group at the University of Toronto, as well as collaborators at the Ontario Tech University, we really worked with the TAG group to come up with new updated targets for the PAHO region. I can have the next slide, please. So what I'll do today is I'll briefly overview the PAHO targets and how they were set, but most importantly, share the results of this work with you. So first of all, why did we update the PAHO regional targets? First, the update was consistent with our consensus statement when we released the original targets in 2015, that PAHO would use a phased approach and committed to updating the targets. And as I will show you today, the targets in 2015 were set based on targets that were set in a number of countries, but we didn't have sodium data at the time. So really, when we did the analysis by 2018, we saw that many foods were already meeting those targets, pointing to the need to more stringent and more aggressive targets if we were going to meet the 30% reduction. And in the intervening years since 2015, many more countries have now established sodium reduction targets, both for more foods and for more food categories. And as I mentioned earlier, we now have sodium monitoring data available in many countries. So not only do we have more sodium data available, we also have a number of recent policy initiatives that the TAG took into account in setting the new sodium targets. First off, we have the PAHO nutrient profiling model. I won't be reporting the data against the PAHO nutrient profiling model, but you can see how we use it in setting our targets. And also we can report in more detailed reports the targets a number of ways and how the progress has been. But I think importantly now, a number of countries throughout the regions have set front of pack labeling. And in those front of pack labeling, most countries have established or have now proposed thresholds for sodium in the content in processed foods. And of course, we now have WHO global sodium benchmarks for a number of food categories. So we also use those data to make sure that we were aligned and consistent with the WHO benchmarks. Next slide, please, Luis. So how did we set the new targets? So as I said, we had very little data in 2015 to set those earlier targets. It was really based on the targets that had already been set in 4 countries, as well as we examined the UK targets, but although we did not use them in setting our targets. But we had very little data available at that time. But in 2015, PAHO supported data collection through a number of countries, and then that data was subsequently reported later on in a paper that you can see a link to, and I can send you links later on if you need. So when we came to setting the 2022 targets back, well, we started the work about 2 years ago. We now had targets from 10 countries, and you can see them listed here. Additionally, we reviewed the updated targets from the United Kingdom and from the World Health. And now we had monitoring data for 19 countries. So it really helped us to determine both the feasibility and the how realistic our targets were relative to the data of sodium levels actually sold in foods in Latin America. Next slide. So with that, we have, as I said, this is now a data-driven approach to setting the targets. So the targets were set 2 ways. First, expressed as milligrams per 100 grams, and that is consistent with the way we expressed our sodium levels in our 2015 data. But we also set them as milligrams per kilocal for those countries who wanted to use that in their other policies. It's also consistent with how the sodium is expressed in the PAHO nutrient profiling model. So although the targets are the same, they're expressed both ways for the use of regulators and for monitoring countries, whichever or both that may be useful for countries. So where are the targets and how are they set? Because we had data from these 19 countries, we now were able to set the 2022 targets based on a 15% reduction from the median levels that we saw between 2013 and 2020. And we also were able to, 2015, so before the actual earlier targets. And then the 2025 targets were set based on a 30% reduction, which is consistent with the WHO global strategy to reduce sodium levels in packaged foods by 30%. And the third thing that we did was not only did we set the targets for both years and express them 2 ways, we also set targets. We didn't really expand the number of food categories, but we actually expressed the targets at the subcategory level. When we were looking at the monitoring data, and I'll show it later, we had such variability, and that was because the foods and many of the subcategories within these categories had wide variation. So our new targets are actually for 75 subcategories, and these are within 16 major food categories. Next slide, please. So in setting the targets, there are a number of principles that were agreed on by the technical advisory group, and these were both in for setting, agreeing on, and monitoring the targets. First off, I think importantly, as I've mentioned today, these regional targets were agreed on and were based on existing national targets and data within the Americas. It's important to point out these regional targets are voluntary, and they're recommended as a starting point for reformulation, because as you will see, we still have more work to do within the Americas. However, governments may still set different targets and are actually encouraged to do so, particularly to set more stringent targets that may be appropriate to their national situations. In other words, where they may have seen good progress, we encourage them to continue to set more stringent targets to help us reach that 30% reduction. And finally, we just go back. Oh, we just lost the slide. I'll continue. The regional targets we committed to would be revised as well, continue to be advised as we continue to have progress. And we may shift categories as we try to see sodium levels go further downwards. And the final principle we agreed on, that both the monitoring and the evaluation with these regional targets would be transparent and safeguarded from conflicts of interest. And you will hear more about that later on. So if I can move to the next slide, please. Now we'll present you some of the data, and this is data collected with a funding from the PAHO region for a number of countries within the Americas: Argentina, Costa Rica, Panama, and Peru. And I've included the Canadian data in this regional analysis, as we had funding from our Canadian Institutes of Health Research to analyze sodium in Canada. So if I can go to the next slide, please. Now, this is some of the food categories, and I'll just take my time. And because there were 75 subcategories, for the interest of being able to show the data to you today, I'm showing them to you on the per 100 grams sodium content milligram per 100 gram by country, but at the major category level. Obviously, there are many subcategories, and there just wasn't room in my presentation, but glad to share the detailed results with anyone who needs them. And we will be publishing these results in the near future. So a couple of things to note. If you look at these data, and these are for the first 6 of the categories: breads, cakes and biscuits, corn derivatives, breakfast cereals, snacks, and cheese products. 2 things I want to point out. Basically, throughout the regions, most of the data are pretty consistent between countries, although you can see for some foods, some countries may be doing better than others, while in other food categories, different countries may be doing better. But I think what's important to notice is look at this high variability. If you look at breads, you can see, for example, the data from Costa Rica, where the average value was just over 500, but you can see that some products went up almost to 1,200 milligrams per 100 grams. So you can see this type of variability in almost all the countries. And that's why it was very important, and I'll show you later on today, why we now have targets both at the subcategory level. So that allows us to more closely refine and examine our data in products that are much more similar, because there are differences between breads, bread products, crisp breads, tortillas that are reflected in this wide variation of sodium levels. But overall, you can see they're pretty consistent. And I want to say that you can see that in most cases, we had over 1,000 products or thereabouts in most countries. We had a much more extensive collection in Canada. We went to 8 grocery chains, much more than many of the other countries. But you can see our countries like Argentina had over 2,500 foods. So we have a very good capture of the food supply in the Americas amongst multiple grocery chains in each of these countries. Now, if you can move to the next slide, this gives you an example of the data from several other food categories. You can see several of these categories are much higher. For example, the processed meats are about twice as high as we saw in the breads, but still seeing this wide variability between countries and within the category, within a food country. And you can see that some, of course, are quite low. For example, the fresh or dried pastas or granola bars are much lower than, for example, the processed meats, and others fall somewhere in between. Now, in the next slide, I'll just show you, for example, the differences for some food categories that look like they're quite large. And this happens to be, I just selectively picked out soups and the sauces. And I wanted to point this out. Sometimes we will see these large differences. And in this case, it actually is a reflection of the methodology. And we're still working on with that with countries. But in the case of some countries, in the case for soups, we do have some concentrated soups as well as unprepared or prepared. So the amount of water, for example, that's added to some of these products will change the sodium levels. So we will work on these data with the countries so that we have consistently expressed all the foods, on a as consumed basis so that we are not comparing concentrated products with diluted products or unprepared products, which are just maybe just mixes without the additions. Now, if we go to the next slide, please. The question is, how are we doing? So this is a summary of how we are doing relative to the 2022 targets. And of course, these data were just collected in 2022. So it's not surprising that for most food categories, and this is overall, through the region, we're only about halfway there. In other words, really about 40 to 50% of the foods are currently meeting these the 2022 or the new sodium targets. And you can see some products are actually just over the 50%, cheeses, processed meats and poultries, and some of the packaged convenience foods, while some are far lower. For example, fewer breads are meeting the PAHO 2022 categories. Now, I want to add a caveat when you see these data. Remember that these targets were based on the existing levels in the region. So in a way, some targets maybe seem somewhat more stringent than others, as in that there may be progress already underway, and in other food categories there hasn't. Or some of the progress may have already occurred in past, and there is less progress going on now. Next slide, please. So now, just to give you an idea overall how we're doing in terms of across countries, as you can see, most countries, about 40 to 50% of foods are currently meeting the 2022 PAHO sodium targets. So that's actually both I guess a good news story and a glass half full story. In other words, we're getting there. We've got some progress, but obviously we still have a way to go. And don't forget, these are just the 2022 targets. And of course, our 2025 targets will be that much more stringent. So we still will have more ways to go as we look at how we're advancing towards meeting our 2025 targets. Next slide, please. And the last data, we're showing it just overall of all the food categories. And just like with the targets, if you look at how we're doing for different food categories by sodium category for each of the targets, you can see this variability again, where we have some foods that are, well, first of all, we have a fairly consistent between countries, but not totally. And you can see that we can range anywhere, mostly about 30% to about 60%, with a few notable exceptions where we're doing quite well meeting the sodium targets. But you can start to see here more differences amongst the countries, but it's not consistently that one country is doing better than others through all the categories, but it tends to vary in some food categories. Some countries may be doing better than others, but for a different food category, another country may be doing better. And some countries are just pretty much in the middle throughout. Thank you. Next slide. So, of course, these data that I presented for you earlier were really all the data around how we're doing regards to the 2022 targets. We really want to know, have we had much progress since 2015 targets were set up? And so we had the data that we had in 2015 that were collected around the time. So what we did is we took our data from 2022, and when we went back and compared those data to the targets that we had set for 2015, where we also had data in 2015, 2018, and of course, our recent data in 2022. This, of course, is only part of our data that we collected in 2022 because we had much fewer data collected and also fewer targets. And unfortunately, if you look at this data, you can see that we had some progress between 2015 and 2018. We moved up from 83% meeting the old targets in 2015 to 89%. But unfortunately, since 2018, we really have had very little progress within the region on meeting the old targets. In other words, from this type of data, it really appears, at least in those targets that we had set targets in 2015, we really have not made much further progress in the intervening years since 2018. Of course, we know there have been a lot of other challenges in the food supply, and with COVID, and many public health agencies were working on their attention was focused elsewhere. But I think this is now a call to say we really need to refocus back on our sodium reduction if we're going to achieve further reductions. So if I can have the next slide. And this is just breaking it down by some of the food categories. As you can see, there's been some progress in some food categories since the earlier data in 2015. We've had some progress in, for example, breakfast cereals, a little progress in meats and sausages, some in the breaded meats and poultry, and of course, some in the snack foods. But in a few cases, we actually seem like we're not doing much better, and maybe we've regressed a little bit. But overall, as you can see, it shows that we haven't had much progress since 2015 in meeting our targets. And I think this really calls for a sustained effort now to refocus our efforts in sodium reduction throughout the Americas. So if you can go to my next slide, and this is just about the end of my presentation, I just have a couple of key messages throughout this presentation. First off, the updated PAHO targets will really help us measure our progress on implementation. And I think it'll also help us see how we're meeting progress in other food policies, something like front of pack labeling throughout the region. I think it's important now that we've now expanded the food subcategories from 18 original food categories that were quite broad to 75 subcategories. And that will really allow us to better both set targets that are more realistic for the subcategories, as well as seeing progress in foods that are much more similar than what was in the large categories, where we had a large range of foods. But unfortunately, less than 50% of food products are meeting the 2022 targets. And progress since 2018 really has been minimal. And so I think these monitoring results hopefully will help stimulate countries to realize that monitoring sodium level is key to really helping improve and ensure progress. And I think also it's important, as many countries have spent considerable efforts in building capacity throughout the years to monitor the food supply, which has allowed us to have key data collection that I've reported today in a very short period of time. But it also can help with monitoring other nutrients, for example, as countries go forward in implementing front of pack regulations. These data sets can also be looked at for other nutrients of public health concern. So I'm just going to wind up with my last slide. And just to give you, you've got the links here, and I'm sure that the Secretariat will send you copies of my presentation. But I've provided in the bottom the links of both the detailed technical report, and that's where all the food categories and the data for all the categories and the subcategories are provided in that technical report, and then the documentation on the updated sodium targets for the Americas. So with that, I'd like to thank you all. Next slide, for your attention. I'd also want to recognize that I've had funding both from PAHO, their office, to help with these regional analysis, and also a great group of students in my lab who did the heavy lifting on running these analyses, as well as funding that I've received from the Canadian Institutes of Health Research. So thank you very much. And Leo, I put one slide in, and I'm going to show this added the next slide. I think it's there. If I can, just to give an example to the countries, as you can see, here's the bread products. When we had it in 2015, you can see a target was 600, because that was based on all bread products combined. But as you can see now, when we can separate different types of bread, it allows us both to have a realistic, more realistic, and in this case, lower target for the pantry and hearth type breads of only 340, which is more realistic for breads. And then recognizing that right now, the tortillas and wraps and that have higher levels. So we recognize that, and those level targets have stayed higher. So that was one of the big move forwards in this presentation and in this regional target. So just to help you know that although I couldn't present all the results at all the subcategory level, those data are there for you to use. So thank you very much. And sorry, I added that slide at the end.
Thank you very much, Mary. It was an excellent presentation, and thank you to explain the process and the importance of our updated sodium reduction targets, which are a little bit more stringent, but are still very realistic. And we see it as well when we monitor the food content in several countries, because we see that there are quite some differences in different countries between the sodium content of similar products. So definitely it is possible to reformulate with those products. So this is important to have these data. Also, I think it's a concern that in some product groups, we are not moving forward, but moving back. I saw, for example, the convenience foods that they are not meeting the sodium reduction targets, and that is one of the groups for which consumption, there's a strong increase in consumption of those groups. So let's now move on to the next panel, and there we will hear from the researchers of several countries that have done this monitoring, including Argentina and Costa Rica, Panama, and Peru, how their experience has been and how they are using the data as well. So I hand over now to Lorena Alamandi, and she is a former PAHO consultant, and currently she is responsible for capacity development, and she is a salt expert as well, working in the NCD Alliance. So bienvenida Lorena y todos los participantes del panel. Entonces,
you're welcome, Lorena, and all of the panel participants as well. So the next 30 minutes will be devoted to this panel presided over by Lorena. Go ahead, Lorena, you have the floor. You're welcome. Thank you. Thank you, Leo. Good afternoon to all participants in this webinar. First of all, I wish to thank PAHO for the invitation given me to moderate this panel. It has been an honor and a true pleasure to share the job that has been carried out by the panelists that will be sharing their information with us as regards research, but also research taken as a fundamental element in order to support the political process which is necessary so that the sodium reduction policies be implemented successfully. So the idea of the panel, therefore, and I will be posing two questions to each one of the panelists for a first round. And the idea is to learn how is it that the evidence that they have been able to generate is now generating and giving way to an improvement in sodium consumption policies in their population. I will follow alphabetical order for the countries. We will start with Argentina. I will introduce Luciana Castronuevo. She's a doctor in social sciences in the University of Buenos Aires since 2013. She's a part of the SICA Argentina group, where she acts as a coordinator for the research area and the various research processes that have to do with the establishment of healthy policies, healthy nutrition policies, articles that have been published nationally and internationally, and has been actively participating in promotion of various policies that have to do with the subject matter that brings us together, to including the national legislation for salt reduction and frontal labeling. Hello, good morning. I'm going to begin with you, therefore, so that you may share with us what is the present situation of the sodium content policies and reduction of sodium consumption among the population, and how is it that you, from your organization, have been using the evidence that was generated last year in order to promote and improve such policies. So I yield the floor to you, Luciana. Go ahead. Hello, everyone. Thank you so very much for the invitation. Thank you, Lorena, for your introduction. I will briefly tell you about the situation in Argentina. Fortunately, in our country, we have two policies that have to do the prevention of sodium consumption for our demography. One has to do with the national law for reduction of sodium consumption dating back to 2014, first law in Latin America having as a purpose to establish goals for sodium content in packaged foods. In the norm that was adopted in 2014 include so meat, um, uh, heads, and others. And in 2019, we made a modification where we established maximum limits plus new categories of foods as such as dressings, mayonnaise, ketchup, and so on and so forth. But besides this actual legislation have to do with sodium content in food, we have the law for the promotion of healthy foods, which was from 2022 in the month of August, a legislation that includes various components, the main of which and was is the scaffolding for this work, as well with the frontal labeling legislation based on the system of nutritional profile by the Pan American Health Organization, and it of course includes warning regarding sodium content in the product concerned. This is our uh, legislation. And with regard to the second question, how did we find the evidence? We in our organization conducted several pieces of work that have to do with sodium content of packaged foods in supermarkets. And this evidence was very useful at different points as regards the cycle of these policies. This evidence was useful in order to include this topic in our agenda. And with this occult salt load motto, we were able to include diseases such as hypertension, amount of sodium consumed that came from the actual salt that was in these processed or ultra processed foods. So beyond scientific publications, other materials that had to do with showing in a clear way the fact that the food that we were consumed, that were packaged, had a lot of sodium that did not register as such, and which was harmful to our health, and therefore it was necessary to promote policies. These had to do and affected the general population, which allowed to set this topic on our agenda. Our decision makers to activate this by way of concrete policies in order to respond vis-a-vis these problems. Besides, we see that this is important once the policy is implemented and when we have to monitor its compliance, which is another great challenge that propels policies. In this case, survey that we carried out last year, as Marie Lave just told us, allowed us to establish which are the goals, where there are greater challenges regarding compliance, what are the challenges that we still have in Argentina with regard to the regional goals, the objectives of our legislation is much more lax than that of the regional goals. So this allows us to promote changes in the legislation that we have in our country. I think that's for the 3 minutes that were allocated to me. Thank you, Luciana. I forgot reminding panelists that the idea is that you may share for about 3 minutes each with us this information and to underscore how is it that evidence has helped Argentina, not just in generating the will and political decision making in order to promote piece of legislation, a policy and regulation, but also to monitor, a great monitoring tool for the existing policies, and how this also helps in order to generate the necessary support from the population in general. I will continue on with another very dear colleague, Adriana Blanco Metzler from Costa Rica. Adriana is a senior researcher at the Costa Rican Institute for Research and Teaching Nutrition and Health in Cienza, a member of a group of experts of PAHO for prevention of cardiovascular diseases by way of reduction of salt consumption. She has received 3 international awards because of her work in reduction of the intake of sodium, and she belongs to various scientific networks, scientific committees, international associations, and national associations related to public health, nutrition, and foodstuffs. You're most welcome, Adriana. I will give you your 3 minutes so that you may tell us about the the present context and policies for sodium consumption in Costa Rica, and how is it that you have been using the evidence that has been generated in support of all these procedures. Go ahead, Adriana. Yes, hello, good morning. Good morning and good afternoon for those of you who are already in the afternoon. To tell you that here in Costa Rica, at this point in time, we have two policies in force. One is a public-private alliance that was signed between the Ministry of Health and the Chamber of the Food, Chamber for Foods. This alliance will expire next month in June. And let me tell you that this alliance, what it was trying to do was to update the goals and targets for Costa Rica, which we had already established previously, and which had been successful to a certain degree, and for which there had been compliance in the reduction of sodium that had shown an increase in the levels of compliance. As of now, as Dr. Mary Labbe told us, indeed, in view of the pandemic and other situations out of our control throughout this period, to say the truth, in our countries, or at least in Costa Rica, we prioritize issues having to do with health, not only the actual steps, but the resources, the economic and human resources concerned, people who retired. We would say, take then that position for COVID or something that was related to the pandemic in one way or the other. So let us tell you that we are now in a standby situation. No progress has been made. And as Mary told us, indeed, throughout the region, this has happened. We are facing an impasse where there has been truly no improvement. Then we have a second policy, which is an action plan for the national strategy in order to approach non-communicable diseases. This runs from 2022, last year, to 2025, which is the period of the new administration. We too are starting a new administration now. So there are things which they're still establishing. As part of the action plan, we have the renewal of the public-private alliance, as well as the updating of the goals for sodium reduction in prepackaged foods. In addition, as part of this plan, it has been broadened to include other critical nutrients, such as trans fats, as well as sugar. We're dealing basically here with sodium. This is a piece of work that has to be started soon, because we have very updated information as to what is the situation today in order for us to be able to negotiate goals. And we have the goals that we have established together with the PAHO technical working group. How do we update these data? We finished generating this data back in November, and it's already May. So 4 months have elapsed. And what we've done up to now are basically transference activities. One that was carried out in December, another one only last week. Today, yesterday was the 18th. That is directed to the healthcare sector. And now we had a last activity where we include all the stakeholders concerned, stakeholders as you call them in English, where we transfer the results. And we drew up also a policy guideline with all this information. This policy document was been published for both activities. And more recently, only this week, we're celebrating the World Week for Salt Awareness. And we're dealing with the content of salt in foods by different means, particularly through the social networks. So basically speaking, not to indulge further, I think that's enough for now. Are we good? Yes, we're good. Thank you, Adriana. Thank you for sharing with us a different outlook regarding the context in Costa Rica. We have voluntary agreements also, and how the utilization of evidence is contributing to the Costa Rican team to socialize among key actors. It's not only a matter of health, but also to sensitize other sectors and population groups by means of different media. As Adriana said, the policy briefs, information documents, which are at times extremely useful for the decision makers. Uh, Indeed. So thank you, Adriana. I will come back to you later on. Let us go on to Panama. For this, I will be introducing Dr. Fernanda Crocker. Fernanda is the coordinator of the Research Center of the Incas for the Prevention of Chronic Diseases. She's had solid experience in epidemiology, nutritional epidemiology, interventions in food policies, public health, nutrition, and monitoring of the food environment. Amongst these, we have the monitoring with position labeling and publicity of foods which are marketed in Central America. Good morning. I give you your 3 minutes also to you and for you to tell us about the job that you are doing with the evidence that you have been able to generate. Go ahead. Thank you, Lorena and colleagues. Thanks to PAHO for this invitation. Panama has an action plan for the reduction of salt consumption 2022-2025, which was approved by the Ministry of Health in December 2022. So it has been launched only very recently. It has 6 lines of action, each of which has a roadmap with very specific activities. And this monitoring that we have conducted here in Panama was framed and responded to 2 very clear lines of action among the national plan. The first is the line that has to do with surveillance and sodium monitoring. We determine the sodium content and trans fats, and then nutritional labeling, comparing with the regional goals according to the categories of foods. And along the same lines, the Ministry of Health has been preparing 2 additional pieces of research. One is the determination of the diet amount in sodium in urine, and also the main sources of sodium, where INCAP will also be participating. This project helped in the line of action of the promotion of the formulation of sodium content and trans fats based on categories and subcategories of processed foods. And to do this, part of the study was that we wanted to divulge the evidence with the uh, manufacturing sector, where we informed them about the goals and the research work that we have done. We presented the gaps that we found toward the attainment of such goals, and the study thus contributed to giving a first thrust in order to mobilize the producing sector and sensitize people about the reformulation. We also established a policy brief with the evidence that is being shared at this meeting, and the Ministry of Health today is pursuing these efforts by making use of the results of the study, which has been identifying priority groups,
Panadería, quesos,
such
embutidos,
as breads, cheese, cold cuts, etc., in order to continue to work with a multidisciplinary group of academicians in order to bring about more awareness at the level of the industry regarding sodium reduction and the attainment of regional goals. There are other lines of action, for example, the formulation of legislation and norms having to do with labeling and promotion. Along these lines, we are also giving very support. We have support by the Ministry of Health to continue thrusting the bill on labeling that is now before the National Assembly, plus coordinating activities with academy and civil society, especially advocacy efforts. There are other steps such as efforts to strengthen knowledge among the population on the importance of such sodium reduction. Ministry of Health has also been designing workshops on nutrition for the first level of care. And last but not least, as regards promotion of these foods, a 6th line of action to prioritize activities invoking the review of the national legal framework to focus actions toward foodstuffs, which is part of the law initiative of nutritional labeling, and a review regarding also the publicity, the advertising. And thus we will get the necessary evidence for this effort. And that is for me within my 3 minutes. Thank you, Fernanda. Thank you again for and because I too was able to participate as a consultant in PAHO of assembling this roadmap, which is indeed a very useful strategy and part of PAHO support toward those countries, which has to do among policies recommended for sodium reduction to work along those different lines. Fernanda highlighted that which has to do with surveillance and monitoring of sodium content, which this study supported amply, and also to resort to official information regarding sodium consumption in the population, which are the sources of such consumption. I'm very pleased also to hear progress that has been made in this regard. So I thank you for sharing with us and updating us on the score of this topic. Congratulations for Panama on the progress, the strengthening of these capabilities in various sectors, and how is it that you're making use of evidence and planning steps in order to advance regarding regulations. Thank you, Fernanda. I will now move on to another of our colleagues. I will moving on to Peru. Dr. Lorena Saavedra, a nutritionist, she's a degree in healthy nutrition, master in nutrition and metabolism from the University of Navarra, coordinator of research projects from the Excellence Center for Chronic Diseases at the University of Peru, Cayetano Heredia, and also the Surveillance Network for Chronic Diseases in the Americas called AMNET. She has developed and conducted research having to do nutrition, public health, food policies, and chronic diseases. You're welcome, Lorena. Hello, good morning. And I give you your 3 minutes for you to tell us about the present context in Peru and the utilization of evidence in support of this process in Peru. Go ahead. Hello, hello, Lorena. Thank you for the invitation. To tell you about the context here in Peru, I would like to begin by saying that in 2013, we had a piece of legislation regarding healthy nutrition focused on children, boys, girls, and teenagers. We have been implementing the different components of this legislation, which include that which is best known, which is frontal labeling, which was implemented back in 2019. We use the parameters of Chile as a reference for the cutting points for fats, sugar, and sodium. With the studies we've been conducting since 2018, we too, together with other countries, have been monitoring the content of these critical nutrients. And I would like to discuss briefly how is it that these changes were made in the reformulation process. In the most recent comparisons we have conducted regarding this assessment, we see that there have been changes in the content of sugar, fats, trans, and not, and also that we have another piece of legislation, elimination of trans fats, which has been quite effective. However, what has been shown as a result of implementing front labeling is that there haven't been many changes regarding the content of sodium. And what is interesting is that the parameters which have been implemented in Peru with for those of PAHO are quite uh, lax for sodium content. As in the second phase last year for frontal labeling, we have realized that there are modifications regarding the modifications and the slight increments in the content of sodium under some of the categories, derivatives of the wheat product line. So is it worthwhile modifying all these parameters we are now considering regarding sodium content? And let me say in passing that the Ministry of Health last year proposed the modification of the parameters to implement PAHO's parameters, which ought to have been the ones that should have been implemented that year when the law was enforced. However, we could not do so because by that point in time, we did not have the PAHO parameters as an official ruling. So we're working along the way to see how we implement these modifications. And from the Academy, we're also promoting regulation of mandatory labeling that will allow us to monitor for all products the actual content of these nutrients, including sodium, since many products, some 25% of them in the market now, don't have a statement regarding nutritional information. and we acknowledge that the most economic and rapid means of making an assessment of the content of such nutrients is by way of the statement made in the labeling. So we're trying to promote that from the research team view. Thank you, Lorena. Once again, in the case of Peru, it is very interesting to see the case of a country that has made so much progress regarding frontal labeling, and how is it that research is precisely now working to improve some parts of the law. Um, she was telling us about some parameters that were too lax, that the legislation should go beyond that which was expected initially, and how is it from the standpoint of the academy, they're making contributions in this regard. Lorena, it was very interesting to hear what you said about the mandatory statement of the content to have the necessary information. The study that Mary showed us initially tells us about many critical nutrients beyond sodium and how that evidence may be helpful for these other issues which are so important in order to protect the consumer's rights and the right to information. So thank you so very much, Lorena. I will come back to you later on. Now, in order to close up this part of the panel discussion, my question is that each one from your own places, the academy, civil society, may share with us lessons learned regarding these processes, the challenges that you have witnessed both institutionally of your own, but also as regards the present political context in each one of your countries. I will ask you again that you take not more than 3 minutes each, and I will introduce a point of clarification. Independent from the fact that this reformulation is indeed a basic policy regarding sodium reduction, also to bear in mind the 5 policies of the World Health Organization package that have to do with surveillance, frontal labeling, restriction to marketing, more healthy nutritional environments, and sensitization of the population in general. So I yield the floor to you now so that you may tell us, according to your viewpoints in Argentina, tell us what are the challenges and lessons that we could leave for the benefit of participants in this webinar. Go ahead.
Thank you. Like the main challenge has to do with the fact that taking part in discussions and everything that has to do with promoting these policies has to do with reforming the food production industry and to make sure that information is trustworthy, reliable, there's no conflict of information on front labeling, having evidence at the local level, in addition to what's taking place in the region. That's all been key for us to be able to respond based on scientific evidence without worrying about there being any particular interest or bias, but that it will be based on evidence that's free of bias. Now, another lesson learned has to do with the work that we have organized at FIC. It's very important for us to produce communication material that's very clear, concise, short, because you don't usually have much time to capture people's interest, given the fact that everyone is bombarded with overloaded with information, so it's hard to get through. So we produce content. It's very different when you're talking about producing an academic paper and the message that we're trying to get out. The communication team needs to know how to take all these different perspectives, bring them together, and sum it up in 3 lines, being clear in what the message is. Something else that is key as a lesson learned throughout this process is to work together with other organizations in articulation with organizations. That these are policies that involve different players, interests, political, economic contexts that can be complex. And so it's very important to work together with international organizations, for example, organizations like UNICEF, PAHO, that's clear, but other civil society organizations, academic organizations, so that we can all present a common front, that we all be clear in what our purpose is, and that we can push for policy change, and also to identify different players throughout the organizations and decision makers. Who do I have to make sure gets information? Who the key actors are? And sometimes that is very painstaking work to find out who the people who are interested in the subject matter is, who also have the power to push through that agenda in the ministries and their agencies, or bring others on board that can ensure that happen. This has to be fluid communication. These are all the different activities we've been carrying out, we did carry out, which was necessary for us to achieve the policy that I referred to. Now, thank you, Adriana. I'm going to give the floor. That is, thank you, Lorena. I'm going to give the floor now to Adriana to hear what your experience has been in Costa Rica. Now, even though ours is a small country, and sometimes we think this isn't going to happen, and we've come to realize that industry is ahead of us oftentimes. As you said, we have negotiated voluntary agreements. So in Central America, it's not mandatory to provide nutrition information on the label. Now, we have an advantage regarding that is, when there is a mandatory labeling, it gives you a leg up in achieving the goals. Outreach has to be carried out through networks, social networks, and other media. Something else that's very important is the government. The government has to buy into these commitments if they're going to succeed, because otherwise, along the way, either progress isn't made or there might be some backsliding. There are bills of law, draft legislation, and other areas that have a bearing on policies that are passed. The front labeling law required much negotiation, but one thing has an influence on others. And so pressure has to be brought to bear. And we learned something else that was very worthwhile. I don't know if this is something other countries have experienced. Oftentimes, products that have already been produced, that are very popular, that fill a niche need, aren't reformulated. They don't want to reformulate their product with a lower sodium content because they're having such success with the product as it is. Now, another challenge is from the standpoint of civil society, without a doubt, we see that they have to follow up on negotiations about targets, taking part in different fora, conversations before the draft bills of law are drafted, and to have a hand in that to the extent possible. Another big challenge is updating targets and monitoring progress with targets. That needs to be done on an ongoing basis. We also need for industry to reformulate those products that already exist. There should be mandatory nutritional labeling. This is something we have been pushing for, negotiating. Time goes on, years come and go, nothing's been done other than the frontal warnings that we have achieved. Now, there are other proposed interventions in addition to the ones that relate to targeting. gastronomy, social marketing, and so forth are examples. Well, that's what I had to say. Thank you. Thank you, Adriana. Let's hear from Panama. I identify with all of the challenges that we have heard about. Without a doubt, one of the lessons learned from our perspective is the importance of outreach or advocacy at different levels for all the different sectors involved. Now, one of the purposes of this study, when we approach the producers to talk about targets, now the producers oftentimes don't even know about the targets. Some are very much interested because they themselves may have product lines with reduced sodium levels. They're always producing new products. And so they might be very interested in the target precisely, given that they have already started these new product lines. But this is very important for us when the time comes for us to approach them. We need to have multidisciplinary teams. On the academic team, we have to have experts, people who can speak in their in the language of these manufacturers or food producers. And now on challenges from the academic sector, perhaps the biggest challenge we always face is receiving sufficient financing for monitoring, for creating, gathering evidence, robust evidence that helps in the decision-making process, and to join efforts with civil society. So that the efforts that are made not be made in an isolated way, but that we pull together. Now, working together with academic sector and civil society, sometimes these different sectors cannot fully fulfill their role owing to a lack of resources or power, coordination, and we have to continue empowering both sectors and to present a common front. There's much pushback from the food and beverage industry against these targets. And so it's necessary for us to mobilize, bring to bear all of the necessary resources to ensure that laws and regulations be enacted, such as the frontal labeling one, not just in Panama, but throughout Latin America. Thank you. Thank you, Fernanda. Lorena, you have the last word from Peru. I don't think there's a whole lot more to say, just based on my own experience. One thing we learned is to take advantage of opportunities that emerge, such as a dairy product that we are dealing with opened the door for us to have a discussion. And through this incident, we were able to involve the academic sector and other sectors of the government to come together and promote this law for healthy food. Now, on trans fat, a year later, that also came up. We also have to be aware in the academic sector and civil society and everyone else involved to continue raising awareness about sodium consumption. So that's the first lesson, to avail ourselves of other people's efforts as well. Now, second challenge, given the political situation, oftentimes we have a hard time in the academic sector to know which politicians we should be speaking with, as there's a constant turnover. So we have to map out these key contacts and know who holds what position from top on down, so that we can offer advice and support them and for them to support us. the academic sector. Now, financing is another difficult thing, not just in the academic sector. In Peru, the National Institute of Health, for example, we've had and encountered difficulties in trying to monitor the healthy food law, its compliance. And so, while there is a law, the fact is there isn't sufficient financing to enforce the law. That the financing was not included in the law to ensure it be complied with. Thank you. I thank the whole panel. It's been very worthwhile to hear from your experiences, to hear about all the work you've been doing, civil society, academic sector, and learning from each other how we overcome the stumbling blocks and barriers that are erected. Now, by way of closing this panel, it is very important that these studies be conducted at the local level, that there be local evidence, as Luciana said from the beginning, for us to have an influence in the political agenda. Financing, as was said, that's no trifle, no trivial matter. We have to have a budget. And so health ministry should also have a line item for this work. Now, just look what happened during the pandemic and where there was a change of focus. And now we've come full circle. We're back focusing on these matters again. It's very important, of course, that this work be done in countries, but across countries. So regionally, we have to work together. This exchange of knowledge to learn what's happening in other countries, other contexts, what succeeded, what didn't succeed. In most cases, the food industry is always one step ahead. And so we need to bolster our ability to substantiate our arguments with evidence for us to make progress. I thank you all. I give the floor back to Leo. Thank you.
Muchas gracias, Lorena y panelistas, por este interesante panel.
Thank you very much, Lorena. I thank all the panelists for all these perspectives. Monitoring and surveillance have provided us with good data, and that's very important for us to carry out advocacy or across sectors. And it's very important for us to receive the data that has been generated in all the different countries. Hopefully, we can bring more countries into this initiative in the future for them to provide data as well, because it's important for us to have this data to determine what strategy we're going to follow. There's the WHO package that talks about the cost effectiveness of certain policies for salt reduction in food, salt in processed and ultra processed food. That's the biggest problem. And of course, reformulation is a very important strategy, a very important tack. And what we're seeing is a rise in the consumption of processed and ultra processed foods. So we do need to turn our focus toward low salt natural foods. Front labeling policy is important. Strictures, limitations placed on advertising, setting standards, all of which are very important. The biggest source of excessive salt is table salt, put in our food at the table. or the salt we add to our food as we cook. And for that, perhaps we could bring about a change in behavior in society with more awareness raising. The virtual campus has its role to play and working in the different environments such as schools to make sure there are standards and limits placed on certain products such as salt, and that there be nutritional education in the school. So it's not just one thing that needs to be done. It's a whole package, a whole array of things that need to be done if we're going to be effective. Now, moving on. Let's hear from the next speaker, Eduardo Nielsen, who has been working with us, a collaborator on salt at PAHO. He is going to tell us about some simulation tools and other ways that we can enhance our advocacy for salt reduction policies. I'll give you the floor. Welcome, Nielsen. He is a researcher from the Osvaldo Cruz Foundation at the University of São Paulo, Brazil. You have the floor, Eduardo. Thank you, and I congratulate PAHO for putting this webinar together. A great way to wrap up this week. I'm going to address you in English.
Primero voy a hablar, por supuesto, I'll speak about simulation studies, and I have no conflicts of interest to report in this presentation. And just to highlight and reinforce what Leo has said, that WHO encourages a set of strategies actually for reducing salt. It depends on what the dietary sources of salt, so reformulation, food procurement policies, nutritional labeling, including mandatory declaration, front of pack labeling, and even health claim criteria, mass media campaigns, including social media, and marketing restrictions and fiscal policies. And this is a little bit of the picture that we have in the Americas. It's very important that we have advanced very much. Mary, Adriana, myself, and other people have been since the beginning of the discussions, I think in 2010, and it's great to see many more countries discussing and implementing sodium reduction policies. And of course, that you see on the right is the scoreboard for the Americas, and we see that we already have 4 countries that were the highest score according to the WHO, which is having 2 mandatory policies at least, and other policies, but we have many countries building on the way to get there. But when you look at the left, we have many countries comparing the regions in the world. We are still falling behind some regions in the Americas, so there's a lot for us to move forward. And and then just a little bit of the evidence to support these declarations is that, of course, we have evidence of an effective hierarchy of salt reduction policies, and we know that multi-component strategies are much more effective, that mandatory reformulation is more effective than voluntary reformulation. And besides, we need to acknowledge the importance of school interventions, dietary advice, nutritional labeling, tax and community counseling, and everything. And so moving directly now to the main subject that I'm speaking of, the burden of disease. We have, of course, the global burden of the disease as a global study, and we have data for all the countries. So it's a very important source for us to identify the dietary risk factors. And what we find is that sodium is the major dietary risk factor that we have in the Americas and in the world, actually. And when we look at the figures, you know that it's actually increasing in terms of the burden, in terms of deaths and disability adjusted years. So it shows a priority that should be given to the reducing salt sodium consumption at the population level. And just a little of overview of methodologies, just so the rationale, so what we can follow up. And the evaluation of salt reduction policies, of course, it depends on what we have spoken. Mary has spoken, Adriana and other panelists about salt consumption in the population, the dietary sources, the sodium content in foods, the prevalences of outcomes as hypertension, morbid mortality from cardiovascular disease. We also have new methodologies that allow us to assess the burden of disease and excessive salt intake. So that's very important because we can have health impact and modeling the economic impact of reducing sodium and even analyzing specific sodium reduction policies. And in that sense, it's very important for us that we have methodologies as macro and micro simulations, which actually are differentiated considering the detail of data that we, how we are grouping all of the populations and working with groups or individual simulations. And of course, what that is the end that we intend to both assess the policies before they're implemented, which means an ex ante evaluation, so we can have better decisions in terms of, and actually help policymakers to make better decisions, more cost-effective decisions, but also evaluate the impacts after we implement all of the policies. And some examples, of course, as I said, they will differ according to data availability, the expertise in modeling, time and development and analysis. So we have many different models that can be used in different contexts, and possible outcomes includes deaths, incident cases, measures of disability or health adjusted years, and also costs, and differentiating between the direct costs that are costs with healthcare, and also indirect costs, which are very important because we have productivity losses to the economy, with costs with pensions and other kinds of indirect costs. And the first study that we have was in Argentina in 2013, and it was very important for the region because it set us a way to move forward. And it actually showed the importance of, in this case, they were studying the implementation of the national strategy in Argentina. It showed a huge impact that could be achieved considering a 10 years implementation period. So that was something that moved us to include this kind of study in the IDIC project of scaling up and evaluating salt reduction policies and programs in Latin America as part of the impact and health economy. So this project was very important. It was brilliantly coordinated by our colleague Adriana Blanco, and it actually I think although the project itself has finished, we still have lots going on, as Mary showed, in terms of all of the monitoring of sodium content in foods, and our current work on the impact in health economics. And this is one of the main models that we've been using in the region, which is PRIME. It's the Preventable Risk Integrated Model which was developed by the University of Oxford. And very quickly, it actually analyzes many kinds of different risk factors, both dietary and non-dietary risk factors. But we will focus on diet and salt, which is mediated, all of the cardiovascular outcomes are mediated by blood pressure. So the model actually is built on is comparing a baseline scenario to an alternative, which we call counterfactual scenario. And this counterfactual scenario can be in terms of salt targets or policy targets, policy options, recommendations, like so we can model many kinds of counterfactual scenarios, and all micro and macro simulations are based on what we call the potential attributable fraction, was actually the percentage of a certain outcome that can be attributed to a risk factor, and that it's based on the prevalence of the risk factor and the relative risks that we have from meta-analysis from literature. So, and it's very important to, it's not very data intensive. So the requirements are basically having the population, deaths by cause, and salt intake, and we can group the analysis in terms of age groups, but we can also have buckets of 5 to 5 years. So we have opportunity to detail even gender perspective and also age group perspectives using and in terms of the country cases, I will start with Prime with Canada, in which we have two very good studies that were coordinated by Mary and we're coordinated and the main author is Nadia, which is a colleague that has been developing a very good doctoral study that has worked on sodium and first working on the attributable deaths to excessive salt intake. So the scenarios are mainly a scenario which we have the national recommendations of 2,300 milligrams of sodium per day, which would reduce up to 3.7% of the CVD deaths. And if we applied the WHO recommendations of 2 grams per day, that would actually have increased the impact to reducing to 5.6% of CVD deaths. And a more stringent scenario of the adequate intake of 1,500 milligrams per day, which would increase the impact in terms of deaths prevented to 9.1% of the CVD deaths. And it's very important that the methodologies can also be applied for policy options, as I said, and they published a very interesting study working on the impact of different scenarios of front of pack labeling in Canada. Of course, in this case, it's not only focused on sodium reduction. It involves sugar, fats, and sodium. So there's a major impact that we can see as long as we consider more stringent criteria, as for example, using the PAHO nutrient profile. So we can move forward in terms of comparing policy options using this kind of methodology. And we have also applied that to different contexts. So we're comparing first Argentina, which is different, but then Canada and now Costa Rica, which is we've done a lot of work in terms of attributable deaths, and it also showed a huge impact that we could go up to 13% of CVD deaths in terms of reducing average consumptions to less than 5 grams per day of sodium. And we have a more modest scenario, not so optimistic, where reducing 15% of salt intake would reduce CVD deaths by 5%. So it's very important. And one important point of the model that we can also look at the different causes of death. And here are, of course, we are modeling most of the cardiovascular diseases. So we have different types from ischemic heart disease, cerebrovascular disease to hypertensive disease. And we can also use other methods that we developed, a microsimulation cost model, which is like mirrored in Prime, which can also be used for calculating the cost total of excessive sodium. That's what we've done in Costa Rica and in Brazil. So we have the costs to the health systems, and we also estimated the indirect costs of productivity losses from premature deaths, and it shows a huge impact in all scenarios, even Costa Rica, for example. And it's a great subsidy for policies because we can show the burden of disease and the economic burden of this risk factor. And we have some new studies from other countries. We worked on using Prime in Paraguay. We've shown a very important potential impact of reducing sodium consumption to less than 5 grams per day. Almost 30% of CVD deaths could be avoided, could be prevented. And we've also done that for Mexico and in different scenarios. And so first we modeled the impact of all the attributable deaths to excessive sodium consumption, and then modeled 2 different scenarios and considering 10% and 30% reduction as the WHO goal for 2025. That so we can show there's a huge impact, and that can actually subsidize many of the policies. And this study has actually been approved for publication in PMC Public Health. It will be available soon. And it's important that we're also working on front of pack labeling studies in Mexico, so we can help other countries with these methodologies. And finally, in Brazil, was the first studies that we use as Prime in the region. We've shown also a huge impact, 15% of CVD deaths could be prevented if we have reduced our sodium consumption to the WHO recommendation. And also we have a huge economic impact, both in terms of direct healthcare costs and also in terms of the indirect costs. So it's totaling almost $1 billion per year. And this is an estimation of the cost, both direct and indirect, that we have. And one very recent study is very important to stress. We've been using PRIME, this model, for many of the studies, and it's important to show that we have a model that has been considered of high credibility, high robustness, and high transparency. And actually, this study it only included studies that were published until mid-2020, and that's why only the study from Brazil was assessed, but it was very well assessed, as you can see. And it actually proves how important and how we're moving in the right direction in terms of continuing to use PRIME in the region. And of course, we have moved forward in Brazil, working with other methodology, in this case, a microsimulation, which we partnered with the University of Liverpool. And this methodology allows us to project the impact in the future, as has been done in Argentina. And we see that first we started on monitoring, assessing the current voluntary targets in terms of their impact. We see there is a very good impact, a huge impact, both in terms of health impacts and economic impacts, but we just think that there is the glass half full. And so we started studying the impact of different strategies in terms of reducing sodium content, the average sodium content, and we see that mandatory reduction is mandatory reformulation is much more impactful than voluntary reformulation. So that's something that we should move forward, and we should add other policies, like perhaps studying the possibility of potassium salt at, of course, front of pack labeling and media campaigns, so we can build up this multi-component strategy that can actually move forward in terms of reducing as much as possible in terms of sodium reduction. And these are some of the preliminary results that we have in terms of the impact on both cases prevented and the deaths prevented. So we see it's a huge impact comparing the mandatory lowest targets in the world compared to the continuity of the voluntary targets. And that's actually something we're working with the Ministry of Health to, although we have stopped voluntary targets, we stopped negotiating them around 2018. We still was starting on updating the data at that point, but it's important for us to start discussing the mandatory targets as our goal, because we see that they're both a health impact, but also a huge economic impact in the long term for all of the strategies that we have. And we actually use this data to write a policy brief to our decision makers, showing the differences between voluntary and mandatory targets. So it's something that we need to do. And here in the middle, we can see that there is lots to, we have seen huge, the countries have worked a lot together, but we have, in terms of the first agreements, the second agreements, but for some categories in the fourth agreement, especially meat products, we have much more trouble in terms of achieving the targets, and something that should be discussed, and mandatory targets would actually help it to be more impactful. And its final challenge is something that has to do with Leo has said at the end, is that we're, of course, we're speaking of reformulation as reducing the damage that is done by excessive sodium in processed, ultra-processed food, but we should address also all of the policies that are linked to reducing the consumption of ultra-processed foods in the region. Here's an example from Brazil. It's the only modeling study to this point that has been done, but only in Brazil, we have 57,000 deaths that are attributable to the consumption of ultra-processed foods, and even small reduction like 10% would provoke a huge impact in terms of deaths prevented and postponed. So that should be considered in terms of the policies. And for my final slides, I'd like to give some encouraging words that we have many studies in the Americas and now in the Caribbean as well that haven't been published, but we've already done that using PRIME and other macrosimulation models, and showing that it can be applied for different contexts and for estimating health and economic impacts. And they have a huge advantage of being more user-friendly and not very data-intensive. We have a growing number of researchers involved. So we have Adriana, Nadia, Mary, we have Jorge from Mexico, Rodrigo from Paraguay, and I have worked together also with researchers from Colombia and other countries, and moving to also to the Caribbean with Barbados and Jamaica, which we have working in not only on salt reduction, and just stressing the opportunities that we have with the data that was provided by Mary with Flip, that we could use that linked to dietary survey data to provide us with opportunities to evaluate the potential impact of salt reduction, front of pack labeling, trans fat elimination, ultra processed foods, taxation, and everything. So we are open to sharing the methodology and consultation to other countries so we can work together and use these tools for actually optimizing policies and building more cost-effective scenarios, what have been policies for all the countries. Thank you very much.
Thank you very much, Eduardo, for presenting these interesting studies, which also how we can use the data and why they are so important for advocacy and to help us defining our course of action. Thank you also for highlighting that mandatory policies are more effective than the voluntary policies, and that brings us to the next presentation, where our colleague Fabio Gomez, who is regional advisor in food, nutrition, and physical activity, will present us a little bit about how we can implement these targets in a mandatory way, and why this is more effective than doing this in a voluntary way. Entonces, Fabio, tienes la palabra. Adelante.
Muchas gracias, Leo.
Thank you so very much, Leo. I hope that you can hear me and see my presentation on the screen. Thank you very much. I deem that out of what we have heard today, we see the relevance and importance in many of the talks as far as the experience of the countries is concerned, as well as the process of building up all these recommendations. It has been stated repeatedly that at many points there is an interaction with other actors of the commercial sector. And it is therefore basic that we're clear as to how to manage these interactions so as to avoid any sort of interest conflict that may hinder protection to public health, which is, of course, our main objective. We acknowledge that in order to adopt all those targets with which you're familiar, we add something here for those who have not yet have access. You can use this code that we have here on the left further beyond the links that have been sent to you through the chat. This is a strategy to reduce sodium intake, which goes beyond the mere formulation. But the idea is to include within this group of actions and speak about the importance and adoption of these targets and new policies and how to handle this interaction with various actors so that we may effectively attain such policies. This is indeed very important. In many countries, they were discussing who should be in charge of this task, who should be the leader. The health authorities are the ones that are leading now these initiatives, because from there, we will have greater certainty that the actual final objective is reached, be it health protection and not others, and that objective will be the main objective. Besides this, the adoption of the goals is important for us to limit the presence of such products in the market. It is just a matter of fact that those products may exist in the market under various options, but the only available options for consumption should be those which are truly going to reduce the intake and consumption of these products. And even if we reach such targets, We acknowledge that many of these products will continue to have an excess sodium content, perhaps not within their category or their identity standards, but in spite of this, they might be excessive in sodium consumption, and therefore the consumption should be restricted. This is why we're speaking about the policy that should be applied: frontal labeling, marketing, other atmospheres, environments, the reduction of other modalities which are related to the food system, so that we may indeed have a clear understanding and an ample application of the strategy of sodium reduction. Finally, to highlight, and this is the main approach of this presentation, to say that these actions many a time are carried out and they involve more than one sector, not just the health sector, but also other government sectors, and oftentimes the interaction with other actors of society outside the government. Therefore, it is paramount that we have adequate safeguards against possible conflicts of interest, without which we could spend many, many years and we could lose a great amount of time or retard this benefit for the population, or we could reach to a policy result that be very weak, and that with the passage of time, it will lose its effect because an erosion of the effect will be caused by many reasons. Amongst them, there is the consumption of ultra-processed foods. If there's a reduction of sodium, which is not substantial in the case of processed or ultra-processed foods, and we continue having a substantial increase in the consumption of those processed and ultra-processed foods, this sodium reduction will result will have an impact on the reduction of the sodium consumption, but it will continue supporting the increase in sodium. So we have to take this group of products, even those that have attained the goals, which are still excessive as far as the sodium content. Interaction, therefore, with such actors, those who manufacture and expand those products, may become something that we can deal with. Considering, therefore, this need where member states always convene us and ask us to support it, we have thus developed this roadmap in order to help countries to prevent and deal with conflict of interest in nutrition policies at the country level, to provide and present the questions rather than the answers of measures that countries have to be taking when interacting with other actors, especially in the manufacturing sector. And this is basic because many countries have clear rules for their officials as to how they can perform with external parties, but they're not clear as far as the institutional performance of the government agencies with the commercial sector. And this could generate certain interactions, which at a given point in time, and because of their very inadequate nature, that will compromise the designing of policies and implementation and application of the policy. So how can we deal with this conflict of interest? What is most important to find a solution is first to understand and recognize that there is indeed a problem. If the state or the government agency does not recognize, does not admit that a conflict of interest problem exists, we will not be making much progress on a solution, because if there's a problem, we require a solution. So the first step in order to forge ahead in reducing conflict of interest is to discuss the issue and be able to understand the problem, and that any actor who is about to be regulated may have his or her participation also restricted in this process, without which we cannot guarantee the primary objective. We may have contamination of other secondary or corporate objectives that may interfere with the primary objective that we have, which is health protection. So it is very important, therefore, that the states, the experts, civil society may hold this discussion and to highlight the relevance and importance of this problem so that we may obtain that social recognition that the problem actually exists and we can forge ahead toward a solution. When we think of the problems, also we have to think in terms of what causes them. Oftentimes, the introduction of a conflict of interest does not actually stem from the state or the regulatory agency, but rather it has to do with the tactics of corporations which are trying to interfere in policies to promote their corporate interest. And we know very clearly, and this is evident now in the world of processed and ultra-processed foods, but we have documented this for the region of Latin America and the Caribbean. But this has to do with interference that the tobacco and alcohol industries carry out with very similar tactics. So these sectors in the industry, which are the producers, manufacturers, the promoters, or which are associated to those sectors in order to promote those unhealthy products, they have the tactics which are very similar among them, which are applied in a circular manner, as a vicious circle. And they attempt at every stage of the policy cycle to impinge on the policy process so as to make the policies favor them. They thus are against the policy that will bring about advancement and apply the mandatory policies that we have decided upon based on evidence and a very rigorous base of experience gained in our region. So they try to prevent this from forging ahead, and they propose substitutes for such policies, such as this perhaps might be another approach which can be focused on education, or saying that we do not need photo labeling, or that we must not restrict the sales of processed and ultra-processed foods. But they just say that they just say that they have to avoid consuming and buying such products. If the policy and the presentation of it advances, it starts retarding the application of the policy and introduces doubts. Do we need more evidence? They make you wonder, are we sure about what we're doing? Should we proceed with these policies? And they do that to delay the process, or the policy has not yet been able to be substituted by something weaker. Also, when they are not capable of delaying things further,
debilitar la política, ya que va
they try to promote these policies until they're adopted, and they try to weaken the parameters to reduce the targets or to change the criteria for frontal labeling and not to restrict the space for advertising as part of the legislation, etc., etc. They're always attempting to generate spaces where they may weaken further the policies which are being promoted by way of a policy of good practices. And they attempt to delay once again, to retard and to prevent, to postpone implementation by proposing deadlines which are much farther away. For 2024, they say we're trying to postpone so that this goal will only be met by 2030 or sometime beyond that. So they try to retard the benefit that could result and that the population could already be having. Based on the experience in our countries, even after designing these advanced policies to adopt a good practice, having periods which are well established. In many cases, the industry perhaps would not insist in promoting litigation against the state, for example, saying that this or that is too rigorous, or that they should not be imposing such or such restrictions. So it is important that we have very clear in mind all these practices, and also to comprehend how important it is to prevent the interaction of these actors in spaces and time which are detrimental, because this will have an impact on the policies that I mentioned earlier. So some of the experience in countries that have managed to adopt more rigorous policies and in a shorter time lapse, those that bring about restrictions or that veto the participation of the sector, which has to do with the regulation of the policy. One thing is to open up to public consultation a proposal based on evidence and experience and the recommendations of the World Health Organization, or PAHO, rather to open a proposal which is studied only for the that sector in the public consultation. Another thing is to have part of the vote, the regulated sector, as one of the voting parties or one of the decision makers regarding such policies. This will slow down our work, both as regards time, as well as the actual strength of these policies. The importance that the government agencies should not allow for these unhealthy products, should participate in the formulation, monitoring of these regulatory policies, because if these are the regulated actors, they should be independent in assuming their policies, and not to establish a difference between the ones who are regulated and the ones who regulate. Finally, in the case of countries that have been able to make progress regarding more strict policies and lesser time, are those that have been able to empower civil society organizations in monitoring and presenting the tactics of those actors, ensuring that this relationship and such interactions with the decision-making bodies may be protected and safeguarded from conflict of interest. With this, I conclude my presentation. I thank you for this opportunity, and I am available to respond to any question that you may have. Thank you. Thank you so very much, Fabio. Indeed, very interesting, the presentation that you've made. Excellent presentation, which gives us certain guidelines as to how to handle this situation. In the chat, I have just included some questions which are often made by the industry or others who have misgivings as regards the targets. So on this web page, you can look at the various possible answers that may be given. We, of course, promote the mandatory implementation, which we've seen not only in reformulation, but also by way of other policies, such as advertising restrictions, where a piece of legislation is much more effective. Also, it puts all of the producers under the same conditions. So this is helpful also, that it will not be just one that will reduce the salt content and others don't. When everybody do this together, also the palate of the consumer will adjust to it, and it will no longer realize that there's a difference, and this will result in a very good benefit for health. So the goals should be adjusted time-wise, little by little. Gradually, they ought to become more strict. So I believe that in this webinar, indeed, we have realized what is the importance of having good information, good data. We have looked at the new goals of PAHO, which is already the second set of goals that we have established. the second set of targets according to the studies we have carried out, which are drawn up in a very scientific manner based on information and data of our own region and which may be attained. We have also looked at the importance of having this monitoring data, not just in order to promote certain policies, defending them, but also as a baseline and situational analysis in order to define which policies we're going to be implementing. We've seen the importance also of utilizing a set of policies which has been described in the Shake package. So in combination, this is what is most effective. The importance of moving to nutrition based on natural foods, which are very rich in micronutrients and low in fat, salt, and sugar. And toward the end, we have seen how important it is indeed to have legislation, and that eventually we know that this will give a much greater benefit. We would like to thank everyone for your participation throughout our webinar today. We have had about 150 countries. We as PAHO, with our associates, with our membership, we continue to be open and very pleased to support all the countries in their salt consumption reduction policies and the adoption as well of these goals for the reformulation as a mandatory measure. With this, therefore, I want to wish you a very happy rest of the day and a very happy weekend, thanking each and every one of you, and of course, primarily our panelists and participants for their views. Thank you very much.